We will be able to address questions at this time. So we have a question out there where somebody was asking the question about the agent fees, the assister fees for agents. And yes, on the FMIP program, as well as the OMIP program, if an application is complete, we will be able to issue a $75 agent fee. Agents, please make sure you give us all of your information on the back of the OMIP FMIP application, and please include your tax ID number. Okay, the question is if a physician needs to sign the physician statement just for FMIP eligibles, or is it also for OMIP eligibles? And yes, it's for both programs. And the reason why is because we have one application. So as the process changed to allow the FMIP eligibles into the FMIP program, we also need to use that documentation to make sure that they meet the eligibility requirements to enroll in the OMIP program. So therefore, we will need it for both programs. However, just to make note on that, a declination letter can be used in absence of a physician statement. So if you know somebody is not eligible to obtain coverage in the commercial market and you are able to get them to apply for a policy and receive a declination letter relatively timely, then you can use that in lieu of the physician statement. Okay, so the question is, when does this go into effect? Well, it's already gone into effect. We have started accepting applications for the FMIP program in July. However, we didn't have the application for the program completely finalized until just recently, which you will be able to see it on our website. So after September 1 of this year, we will no longer be accepting the current OMIP applications. You now need to submit applications on the OMIP FMIP application after September 1. But if you have access to these applications now, they're very useful in determining a person's eligibility, and we encourage you to use those. There is a question that is if short-term eligibility is considered creditable coverage, and for the purpose of FMIP, yes, it is. The definition of creditable coverage has been defined. It's a federal definition. It's the same definition that's used on the commercial policies today. So short-term medical is one of those, as well as the Oregon Health Plan. We look at that as to be creditable coverage. So if a client or an individual has had that coverage prior to applying to FMIP within the 6 months prior, they would not be eligible for benefits through FMIP. There is a question as if a person is covered by an limited indemnity policy and states that it is not credible coverage, does that meet the no assurance for 6 months on FMIP? Again, we ask you to look at the federal definition of creditable coverage. There is some policies mentioned within that definition that says it is not creditable coverage, specifically like specified disease, maybe cancer only. Look at the indemnity policy and see what it says and what is covered. If it is a policy that meets that definition, then they would not be eligible for coverage through FMIP. Okay, the question came in is, what if the person doesn't have a doctor? That is something that we've took into heavy consideration when we were working with the federal government. Unfortunately, like we said, this is a requirement that the federal government has required on us when we're enrolling folks into the FMIP program. There are physicians' offices that would be able to, like community or public health centers, and I'm just making an assumption out there. So if you can't get a doctor to attest to the medical condition for which you are eligible for, then maybe it's best to work with an agent to see if you can get an insurance policy. And if not, and you're able to receive a declination letter, then you do not need to have a physician's statement. That is only needed if the person who is qualifying solely on the fact that they have one of the medical conditions on the OMIP FMIP application. Okay, so the question is, how long does somebody have to wait to be covered if they have a 6-month short-term medical policy? And I'm not sure if I'm understanding the question correctly, because the federal requirement to enroll in FMIP means they cannot have had any creditable coverage 6 months prior to the date they are applying for this coverage. So if they had a 6-month short-term policy in effect prior to that, then they would not be eligible for FMIP. However, they could be eligible for coverage through OMIP still. So a 6-month policy may meet the may meet the requirements for creditable coverage into OMIP, and for which we can waive the pre-X wait period. But other than that, they are not eligible for OMIP if they've had that coverage in effect 6 months prior. Okay, so the question is, in somebody submitting an application, what is the normal time frame? And I'm wondering if that means that the average turnaround time. If the effective dates, and I think that is a great question because we did not address that, effective dates are going to be issued the same as they are for OMIP. If we receive a completed application in the so if we receive a completed application, all the information is there needed to process for eligibility, the effective date will be the first of the month following that application. We generally try to allow at least a 30-day processing time. That gives us time to look at the application, review the application, and get the application into the system so that we can submit insurance cards and we can submit the contract. But their effective date, regardless of when they receive their insurance contract or insurance cards, will be the first of the month following the date that we receive their completed application. I also want to make mention that if a separate doctor's note is used, the doctor should reference the same condition that is marked on the application along with their signature and their date. There is a question if there's any consideration of adding the 15th of the month effective date, and no, not at this time. We will do that in special situations with OMIP folks, and that's generally because if they had a policy that was terminated on the 15th rather than at the end of the month, which most policies usually terminate, we will then allow to go back to the 16th on OMIP only. With FMIP, the effective date is the first of the month following the date of their completed application. We have a contract with the federal government, and with our contract, in order to implement this pool, that was the agreed arrangement. The question is, and I apologize because there is a lot of questions that maybe, as we get these questions, we will also be compiling them and then putting out an FAQ on our website, which goes more into detail about some of the decisions and the eligibility process. One of the questions was had to do with when people are on the FMIP program, and there's, I believe it was, if there's no, because FMIP will have limited enrollment based on the money that is collected from the federal government to pay for this program. So there could be times where this program will have a waiting list, and those kind of questions, please look to our website because we will draft up a very detailed response to those. I'm not trying to ignore those questions, but I want you to be aware that we will have some further discussion on that and more detailed about what happens when folks are actually in the FMIP program and the funding is no longer there. How does that work? What happens to these folks? We also have to time this with all the changes that are going on with healthcare reform on a national level, and also within the state of Oregon. So that information will be out on our website very soon, I promise you. There was a question regarding documentation of citizenship and what needs to be submitted or what needs to be proof. Like I said, and I probably went over the webinar a little too fast, we will not be obtaining documentation to show proof that they are a U.S. citizen. However, there is a definition in the member handbook of what a U.S. citizen or lawfully present means, and this is a definition that was defined by the feds. On page 4 of our member handbook, which you can get off of our website currently, has detailed information about this. And for a person who is lawfully present is the only time we will actually be requiring proof of documentation. That documentation is listed on page 4, and it gives examples of what is acceptable. For the folks that are U.S. citizens that we are not requiring proof, there is the affidavit within the application in which a person must sign and date attesting that they meet the eligibility requirements. On the back side of that, we will be doing random audits on all applications received. So it'll be a poll of all the applications we receive on a monthly basis, and therefore we will have to come through them, make sure that these people are in fact U.S. citizens or meet the eligibility requirements of a lawfully present U.S. citizen. The feds are going to be overseeing this, and we have to submit that information back to them. One of the questions is they asked what are the main differences between OMIP and FMIP, and that is a great question. Don Myron had a webinar yesterday in which he outlined the main differences. Because there's a few differences. There's a few differences in the eligibility, and there's a few differences in the benefit design. So the eligibility is, in order to be eligible for FMIP, a person must meet the definition of a U.S. citizen or lawfully present in the U.S. And then they also must not have had any creditable coverage 6 months prior to the date that they are applying for pool coverage. The other thing is they have to have one of the medical conditions or have been declined health insurance. So that's the main eligibility for going into FMIP. OMIP obviously has separate eligibility requirements because we will still be providing coverage for folks who would need portability, who do not have a portability option and have exhausted their COBRA. And folks who have the HCTC credit, which is the federal coverage tax credit, will be eligible to come into OMIP. In lieu of other folks that don't meet the FMIP eligibility but meet the OMIP medical eligibility, they'll be able to come into. Also on our website, we do point out the differences in the plan structures between the FMIP 500 and 750 plans versus the OMIP 500 and 750 plans. These plans also are rated slightly different than they are on OMIP, and there is no pre-ex wait period for these plans. So a person who has not had any creditable coverage will be able to have full coverage effective the date that their policy goes into effect. Okay, so the question had to do with the Care Assist eligible person and the physician statement. Well, in order to be eligible to even get Care Assist benefits, a person must see a physician within the DHS organization. There is a physician statement that is completed determining their eligibility into Care Assist. We have worked with the Care Assist folks to determine that documentation will be you can use that as the physician's statement. So we'll just need a copy of that with the Care Assist application. One of the questions is, what is your best recommendation for finding people that may qualify for OMIP and or FMIP? The application itself is, like I said, is designed to help people navigate through which benefit plan works best for their situation and which one they're eligible for. Obviously, if a person is coming into coverage and has not had any creditable coverage, the best bet is to try to get them coverage through FMIP because, again, there's no pre-existing wait period. For folks that are in OMIP, just the same, people who can't get insurance based on medical conditions or they are leaving they've exhausted their COBRA. If you're working with those folks, it's best that you were able to provide them with the information necessary for them to obtain coverage. We are out there, we are doing a lot of outreach, we are working with other agencies, we're trying to get information out there for folks, we are working with caseworkers, hospitals, people who need coverage and aren't aware of this program. It's good for them to be aware of the eligibility requirements, and we are trying to work very hard on that. Okay, so at this time we're going to go ahead and wrap up the questions session of this webinar. Again, we will be posting information on our website regarding the FAQs that were generated from this webinar, and we appreciate your feedback and thank you very much for attending today, including with all of our technical difficulties. Thank you.